What if I told you three men walked into my office with three completely different problems, and all three had the exact same organ slowly breaking down inside them? One thought he was just getting old. One blamed his diet. One didn't even think anything was wrong. None of them suspected what was actually happening. And by the end of this video, I think you'll understand why that terrifies me and why it should matter to you. My name is Dr. Reena. I'm a board-certified urologist with over 12 years of experience working specifically with men over 50. And I want to talk to you today about an organ that almost never comes up in these conversations, even though it's silently responsible for some of the most commonly dismissed symptoms men experience as they get older. Before I tell you what that organ is, let me finish those three stories. The first man was 67, retired, still sharp, still active. His only complaint was that he felt drained, not sleepy, just hollow, like something inside him had quietly been switched to low power. He'd also dropped 11 pounds over 4 months without changing a single thing about how he ate. He figured it was aging. He almost didn't come in at all. The second man was 63. Every time he ate something rich, something fatty, something he actually enjoyed, he'd feel a dull, heavy pressure just under his ribs, sometimes bleeding around toward his back. He'd been managing it with antacids for months. He thought he had a food sensitivity. He started eating smaller meals, cutting out the things he loved. He thought he was doing the right thing. The third was 71. His daughter dragged him in. She'd noticed he was losing weight, moving slower, and had stopped eating the foods he always loved. He called it stress. He called it age. Three men, three completely different stories. And every single one of them had the same underlying problem: the pancreas. I know that's probably not what you expected. When men hear fatigue, they think stress or poor sleep. Pain after eating, probably reflux. Weight loss, just the body adjusting. The pancreas almost never enters the conversation, and that silence is exactly what makes this so dangerous. This organ, about the size of your fist, tucked quietly behind your stomach, does two critical jobs every day. First, it produces the enzymes your body needs to break down fat, protein, and carbohydrates. Without those enzymes working properly, you can eat a full meal and still be running on empty. The food goes in, but the nutrition never really reaches you. Second, it produces insulin and glucagon, the hormones that keep your blood sugar stable. When that system starts to wobble, even slightly, the effects ripple through your entire body in ways most men never trace back to this one small organ. The pancreas doesn't fail dramatically. It doesn't announce itself. It whispers. And those whispers disguise themselves as 7 things most men write off without a second thought. The first whisper is something nobody wants to bring up: changes in your stool. Not occasional irregularity, a new pattern that's been happening for weeks. Pale or clay-colored stools. Stools that float or are difficult to flush. A greasy or oily appearance. An unusually strong foul odor. When the pancreas isn't releasing enough digestive enzymes, fat passes through your intestine essentially unprocessed, and fat carries the vitamins your body depends on: A, D, E, and K. If fat isn't being absorbed, neither are they. The result shows up slowly as fatigue, weakened immunity, softer bones, things men chalk up to getting older. The second man I mentioned had been dealing with this for close to a year. By the time he came in, he had measurable vitamin D deficiency and had been protein deficient for months. Not because he wasn't eating, but because his body had quietly lost the ability to extract what it needed. The second whisper is pain after eating, and it gets misread almost every single time. A dull pressure or ache in the upper abdomen, just below the ribs, sometimes on the left side, sometimes reaching around toward the back. It tends to show up 20 to 40 minutes after a meal, especially a heavy or fatty one, and can linger for hours. Most men reach for antacids. Most assume reflux. And sometimes that's exactly what it is. But if the pattern keeps returning, worsens specifically with fatty foods, and antacids don't fully resolve it, that combination changes the picture entirely. When the pancreas is inflamed, eating is literally a trigger. It calls on the organ to produce enzymes it's struggling to make, and the organ pushes back. The third man I mentioned had unconsciously reorganized his entire diet around this pain. He thought he was eating healthily. He was actually protecting a struggling organ without knowing it. The third whisper, and this one gets dismissed the most consistently, is persistent, unexplained fatigue. Not regular tired, not sleep debt tired, a specific kind of exhaustion that doesn't lift, a heaviness that was never there before. Here's what most men are never told. When the hormone-producing cells of the pancreas are compromised, insulin output becomes inconsistent. Blood sugar rises after meals, then crashes. And when it crashes, your brain, which runs almost entirely on glucose, starts to falter. That's the fog. That's the flatness. That's the feeling of being present in a room but somehow not quite there. There's also a simpler explanation sitting underneath all of it. If your digestive enzymes aren't working properly, your cells are receiving less fuel even when you're eating 3 full meals a day. This is an underappreciated, underdiagnosed cause of fatigue in men over 60, and standard blood work alone often misses it entirely. The fourth whisper is the most deceptive one: unexplained weight loss. Men often welcome this at first. The belt fits a little better. They figure the body is finally adjusting. But losing weight without trying, without changing your diet, without exercising more, without any deliberate shift, is one of the signals medicine takes most seriously. When the digestive system is failing, you absorb fewer nutrients from every meal. Your body begins drawing on its own reserves. And after 60, muscle mass is already significantly harder to rebuild than it was before. There's also a behavioral layer that's easy to miss entirely. When eating consistently causes discomfort, the brain quietly learns to resist it. Fatty foods disappear from the menu, portions shrink, favorite meals stop appearing at the table. The man sitting across from you on a belt notch he's never used before didn't make a decision. The decision was made for him, slowly, over months. If you've lost more than 5 or 6 pounds over 2 to 3 months without a clear reason, that is not background noise. That belongs in front of a doctor. The fifth whisper is nausea, and it gets dramatically underestimated. Not nausea with an obvious cause. Recurring nausea after eating, sometimes even without eating, that keeps coming back no matter what you try. When the pancreas is inflamed, eating activates it, stimulates it to produce enzymes it's struggling to manufacture, and it responds with a wave of nausea. It's essentially the body saying, slow down, don't overload this. Most men push through it, adjust their diet around it, take something for it, and never once ask why it keeps returning. The signal goes unread, the cause continues. The sixth whisper is one most men never even recognize as a symptom: loss of appetite. Not dramatic, not sudden, just a quiet, persistent disinterest in food that wasn't there 6 months ago. Meals that used to feel like something to look forward to now feel like something to get through. You eat because it's noon, not because you're hungry. When eating is repeatedly followed by discomfort, your brain builds an association. Eating equals pain. The appetite steps back. Portions shrink. Meals get skipped. And this compounds everything else on this list. Less food layered on top of poor absorption accelerates weight loss, deepens fatigue, and makes every other sign worse. The seventh whisper is the one most often investigated in total isolation: new blood sugar changes. Increased thirst you can't satisfy. Frequent urination, especially at night. Vision that blurs and clears. Shakiness after skipping a meal. An energy level that swings unpredictably based on what and when you eat. When the hormone-producing cells of the pancreas are damaged through chronic inflammation or more serious disease, insulin production becomes unreliable. What looks like diabetes may not be conventional type 2 diabetes at all. There's a condition called type 3C diabetes, real, significantly underdiagnosed, and caused by direct pancreatic damage. Treating it like standard type 2 without identifying the root means the treatment is incomplete. New blood sugar instability in someone who previously had normal levels is not a minor metabolic footnote. It's a signal worth tracing all the way back to where it started. Now, and this matters, none of these 7 signs alone tells the whole story. Fatigue has dozens of causes. So does nausea. So does pain after eating. What changes everything is the pattern. 2 or 3 of these appearing together, developing over the same period, gradually getting worse. That is when the body is no longer whispering. That is when it is speaking as clearly as it knows how, hoping someone is finally paying close enough attention to listen. So here's what I want you to do before you close this video. Not tomorrow, right now. Write down whatever you recognized in yourself while watching, when it started, how often it happens, what makes it better or worse, what else changed around the same time. That kind of specific, honest observation is worth more in a doctor's office than most men realize. It turns a vague, dismissible complaint into a concrete pattern that a physician can actually investigate. Your doctor will likely start with blood work, a complete metabolic panel, a lipase level, fasting glucose, or HbA1c. They may add imaging. A CT scan or MRI can reveal changes in pancreatic tissue that blood work alone cannot show. In many cases, the underlying cause is manageable: chronic inflammation, enzyme insufficiency, dietary factors. Caught early, the outcomes can be genuinely good. In some cases, these signs point to something more serious. I won't pretend otherwise, but the men who do best are not the ones with the cleanest history. They are the ones who came in early and said, "Here is what I've been noticing. I want to understand it." I want to say something directly to the man who recognized himself somewhere in this video. Not the dramatic version, the quiet version. The man who has been more tired than usual for longer than he can fully explain, who has been quietly working around discomfort he hasn't named yet, who noticed a few pounds gone and told himself it was probably nothing. You are not being dramatic. You have spent decades showing up for everyone and everything that needed you. Showing up for your own body is not weakness. It is the same seriousness you've brought to everything else in your life that mattered. Getting older does not mean accepting less. It does not mean settling for a version of yourself that is perpetually tired and working around symptoms you've never fully understood. Vitality at 60, at 65, at 70, and beyond, it is not a fantasy, but it requires paying attention. It requires deciding that your health deserves the same care you've given everything else. Your body is not working against you. It is doing exactly what it was designed to do, sending signals. The only question is whether anyone is paying attention. If this video gave you something useful today, leave a comment and tell me which of these signs felt familiar. You may find you're not alone in it. Like this video if it felt worth your time, and share it, because there is almost certainly a man in your life who needs to hear this and will not go looking for it on his own. Subscribe so you don't miss what's coming next, and take care of yourself. That's not optional. That's the whole point.